Hi, I'm Shannon Welch from the Institute for Healthcare Improvement. Welcome to our virtual conversation series, Leadership Insights, where we talk with IHI's experts and partners. Today, I'm speaking with Jamia Dorsey, CEO of the Center for Black Women's Wellness in Atlanta, Georgia, about how her community-based organization is applying the Equity Action Lab model in their work. Welcome, Jamia, and thank you for talking with me today.
Thank you for having me, Shannon.
Great. Well, you and I have had the privilege of working together as part of IHI's Better Maternal Outcomes, which includes some of the methods and practices from the 100 Million Healthier Lives movement. 100 in Lives was an initiative that IHI convened, which aimed to transform how the world thinks and acts about health, well-being, and equity. While the movement has come to an end, it lives on through the ways we work with communities, including yours. With all that you're juggling in your leadership role at the Center for Black Women's Wellness, can you share why being a part of this journey together has been meaningful?
Sure, Shannon. Well, it's interesting. So we are a community-based nonprofit organization. We are a direct service organization. And so we chiefly provide healthcare for uninsured women. We do some work around financial literacy. And a big piece of what we do is maternal and infant health. So specifically, we have a federally funded Atlanta Healthy Start project where we are providing home visitation to pregnant and postpartum women. And so with that work, though, we know that we've always looked at maternal and child health, yes, from a direct service aspect, but we also know that it is a collective effort, right? That while our approach is really very micro and meaningful, I mean, we see change in lives every day, that it really takes a collective group of stakeholders to really truly move the needle when it comes to systems change. Like, how do we really address these issues of health inequities, racial inequities that are pervasive and that one organization alone cannot do? So we were really thrilled with the opportunity when it presented itself to us because we had already been working for many years with a group of committed stakeholders. We consider them to be an interdisciplinary team. We also already were involved with, program participants and former participants, and this notion of working with women with lived experience to bring them all together to be a part of creating solutions for their community. We were just thrilled to be a part of. We didn't know all these technical terms and what the journey would bring to us, so we learned a lot. But it's been really worthwhile, and we've definitely embedded a lot of what we experienced in the work that we're continue to do and in our culture.
Oh, wonderful. Thank you. Well, my goodness. As you've mentioned, you all have been doing great work with a variety of stakeholders, and we're so thankful that your organization elected to participate in the Better Maternal Outcomes Project and use the Equity Action Lab model that helps provide structure and focus to bring together a diverse team of stakeholders, like you mentioned, women with lived experience, various community partners, to make meaningful progress on a health equity goal in a short amount of time. Now, in your leadership role at the center, can you tell us how you applied the Equity Action Lab model in your community and perhaps some of the outcomes as well?
Sure, Shannon. Well, I think that you hit on something that I want to just lift up. It's the structure. Because I think that in terms of delivering programs, you're very intentional about the planning, the implementation, the evaluation. And as a community organization, some of that stuff is just intuitive, and there's work that you have to be flexible and meet the needs of the community. So it's not that it's prescribed, but there's a lot of flexibility with that, so to speak. And so with our working with stakeholders, it really had been pretty fluid and informal. So one of the big learnings was that, okay, in this work, some of the things that we realized was that in order to move the needle, we actually needed to have some structure and even some formal agreements. So as an example, we were working with Grady Health Systems. We had been doing recruitment of pregnant women for years there, but we had an expired agreement. So doing this work with this action lab not only brought former partners together and new partners, but it made us think about, okay, well, if we're really trying to do work around removing the silos, as an example, and creating better connections between healthcare systems and community-based organizations, wouldn't it make sense that we actually had an updated agreement that talked about actually how we do that work? What could it look like to actually provide data to each other? Wouldn't that make sense, especially because leadership changes, right? So if the leadership changes within a system, then the new leadership that comes in, they need to know the importance of this partnership. So that's just one example. When we got together and did our first equity action lab, I believe it was in September of 2019, and we all came together, the three areas that we decided to work on, one was removing the silos. So there was this natural gravitation towards wanting to do more of that work around healthcare systems and community-based organizations. Another one was around respectful care. So that was a big theme that resonated with folks, especially the women with lived experience. They were really excited about that kind of bucket of work. And so we had a design team that began doing work around that. And then the other one, which is the team that I was on, was called Shared Leadership. And so that was really around how do we develop messaging so that we're working with hospital leadership and really talking about the impacts of racism as it relates to maternal mortality. So that was a new journey for a lot of folks. We actually made racism something that was like front and center in some of that work. And that was uncomfortable for some folks. But as we went along the journey and we learned so much around the impacts of maternal mortality and what was going on in terms of the inequities, people over time became more comfortable with it. Also, what really happened was that for some of us, we had been working together for years, but other organizations were really new to the table. And they really had never had a formal mechanism in which to drive change. So having that and having that opportunity, and I think that the Center for Black Women's Wellness being a community-based organization kind of helped bridge the gap in that way. And it made people feel more comfortable working with each other. And it kind of, I think that the trust got, it got sped up because of the fact that people had been working with us for a while. So those were some of the learnings for us, that it was the structure of it, and how it's affected us as an organization is that it's revealed to us that we even have silos within our small nonprofit, and we're actually doing some design teamwork now with our wellness department and our maternal and child health department, them coming together to drive change and to really test ideas to actually speed up some of the work that we're trying to do.
Oh, that's fantastic. You all have accomplished so much through use of this model, and it's amazing to hear how the community and other partners have come together and been able to kind of break down some of the silos that you spoke about. So based off of this work that you've done, what can other communities learn from your experience?
Well, one is that I will say that in the learnings is that it does take time, and that I mentioned this notion of trust, and we all know that trust is, it's it's always a big issue because you got to have the trust to work together. But we were meeting probably every other week, and so there was like this cadence that the structure allows for. And most people would say, "Oh gosh, especially now in the climate of Zoom and Zoom fatigue," but we found that actually having that very routine, systematic way of working together, again, trust was built quicker, and you actually got to see change happen more quickly. And even the change that took time, there was this vested interest because, like, we're all on this journey. There's a beginning point, and we're going to keep moving. And we know that these action labs are going to happen periodically. And we want to be able to say, well, what happened? At the next, when we come to the next action lab, what transpired? What did our design team accomplish? So I think that having that level of accountability, but also flexibility, because in that, it's like we're accountable to each other, but we're also testing ideas. If ideas don't work, we are willing to test some new ideas. Um, and I think at the end of the day, that was the most valuable experience for us. And again, this shared notion of we are really trying to move the needle together, because what we've been doing before, again, it hasn't been working and we still have these issues.
Thank you. Those are such great learnings to share, especially about building trust and having that accountability structure to be able to keep the progress moving. Now, many people believe that the complex challenges in health, equity, and healthcare, including inequitable outcomes experienced by Black, Indigenous, and people of color, are intractable problems. IHI would not have led the Better Maternal Outcomes Project in the way that we do without 100 Lives. As a community-based family service center committed to improving the health and well-being of underserved Black women and their families, what lessons or strategies can we draw upon given what our communities are facing today?
What lessons or strategies can folks learn? I mean, I think that the lessons and the strategies, really are around, how do we build community working together? How do we engage a community that is most impacted by the problem, and how do we bring them to the table to be a part of the solution? I think that one of the other things that was valuable was just access to technical assistance from IHI, and then also really access to content, subject matter experts that were able to come and bring something that made it attractive and appealing to those who were at the table, so that they were investing, their time in the project, but they were also learning and gaining something as well. So I think that was important, to that it truly was a learning community. And then when you create these learning communities, then that is, you know, that's, I don't want to say the carrot, but that is something that's a big motivating factor. Um, and providing space for people to listen to each other and hear these different perspectives. I mean, when we had our first action lab, as an example, we had a panel of women with lived experience. And some of the folks within the hospital system were really floored by just their perspectives. They had never heard those types of perspectives before. Um, and similarly, we had women with lived experience who had never really been able to dialogue with providers in that kind of informal fashion. So I think that all of that was essential. We had Dr. Joy Perry, who provided great content in our first action lab. That was a tremendous treat for all of us. And we kept all of that. I think that was almost kind of our North Star. I mean, like, we really kept all of that between all the poignant things that she mentioned in that action lab, the first one, and women with lived experience and their stories. I think that was the driving force at the end of the day that kept us going and remembering the big picture.
Oh, that's such an important strategy, how engaging women with lived experience can be so powerful. Now, the Center for Black Women's Wellness is where passion and compassion intersect to connect women to the tools and services that move them toward physical, mental, and economic health. This week marks Black Maternal Health Week. What is your message to women and families into your community?
But it's interesting because it's women, of course, we've always carried the burden and the load. And in this time of COVID, it's been even worse. We have women who are now having to deliver babies within the context of not having the full support system there. We have women who have, whether they're essential workers and they have been thrust into working in a time in which they feel vulnerable, or they have been laid off, or were gig workers, and life as they knew it has been changed. And so I think that when I think about the center and what we can be for women and what we can do in this space of maternal and child health, and strengthening women and making sure that we are thriving and that we are healthy and that we can optimize maternal and child health during this time and beyond. But I'm convinced that together we really can work and continue to make a difference in these areas. I mean, certainly we've been doing a lot of work around virtual home visits, making sure that we are being a support to moms and you know support to the entire family unit, especially at a time where so many women have put their preventive health to the wayside, because of the impacts of COVID. So really making sure that we are convincing women to continue to take care of themselves, to get their health checked out, to build support for themselves and each other. So, I think that there's a lot going on right now, certainly, but, I always remain encouraged, and I feel like there's a place for um, the Center for Black Women's Wellness and nonprofits like us, and there's, just a place for all of us to continue to do the great work to improve maternal outcomes.
Well, we're so thankful that you all are doing the work that you all are doing. It's wonderful. Now, we at IHI recently learned how leaders at NACHO are applying the Action Lab model and work with city and county health departments. They learned about the model from one of our 100 M Lives scale communities, Maricopa County. As a former leader from a scale community myself, this was exciting to hear because it tells us the power of spreading is working through IHI's channels in the communities and now in community-based work, healthcare, and public health. What advice would you give an organization who may be considering adopting this tool to address a health equity goal? And perhaps when might they consider adopting this tool?
Well, there is a readiness. You got to, to be ready. I think you need to really look within to say, do we have the will to do big work? What is our capacity? That is one thing that I will say that we didn't realize the level of capacity that it took. We knew we were committed and we wanted to do it, but you have to be willing to put in the time and see the value add in putting in the time. But I can't speak enough about the process. It is, again, I think every organization, even if you're doing direct service work, you are seeing patients, whatever that is, the systems change work, the work that goes into the macro work, in terms of driving change. It takes time, it takes commitment, but I think with the resources of, the framework and the structure that this process provided, and the technical support that IHI provided, it, I encourage all to really look at it as a model and what that can do in terms of collective work.
Oh, great. Well, let's switch gears here for a minute and talk about the pandemic. It has brought into sharp focus many of the troubling things that we already knew about health disparities and racial inequity in the United States, but have failed to address. You know this better than anyone with the impact your center has experienced due to the pandemic. What lessons have you learned from the pandemic?
I think that what the lessons that I've learned, one is that certainly we've all had to adapt, and there's a lot we can learn from, I'll say, women in general, because women in general have to be adaptive, and so that means organizations and structures and systems have to be adaptive as well. Um, it's interesting because doing our work, we were always such a high touch organization, and face to face contact was what we lived for. And so we've had to adapt to be hybrid. We've had to still make meaningful connection virtually. But then also you have to learn to meet people where they're at and meet the needs of folks. And we had to also pivot and do some COVID relief work to support women directly. And we were, very grateful that we were able to do a part of that. So I think we're still evolving as an organization, as our own culture, as we think about how do we support our staff. We've all been through, this kind of very traumatic experience. How do we make sure that we're healthy and we are doing good self-care and taking care of ourselves? How do we make sure that we adapt to the even now more emerging needs of women who have been having to deal with virtual learning and caretaking and all of these we've been thrust into the many, many roles. And what are going to be the impacts of that really when it relates to maternal health? You know, we know ourselves just as an organization, we've had to do a lot more in terms of mental health services. We've been doing, not only have we been working with partners to do more individual therapy virtually, but we've been doing other things like virtual yoga and all kinds of innovative things to again try to help with the healing that really needs to happen as a result of all that's going on.
Mm. Well, adaptation certainly seems to be the theme of this past year. Now, you talked about how you all adapted as an organization. How have you personally, as a leader, adapted? And maybe what are some of the practices that you've relied upon to get through this last year?
That's a great question because I think certainly the first couple of months we're all like crisis leadership, crisis mode. How do we make sure the staff are okay? That you convey a steadiness. Like, okay, COVID happens. We're in a city-owned building. City shuts down. How do you get a team that again is a high-touch team to be, make sure that they're okay, make sure that they have everything that they need to work remotely, and what does that look like for frontline workers who are so accustomed to going into homes and doing home visitation to no longer be able to do that. So the adaptation was, how does that look now? And so whether it's you're FaceTiming or Zooming, whatever works for mom is going to work for us. And we're going to figure out how to make that contact. It's interesting, actually, home visits became longer. Our family support specialists were saying, because moms just needed someone to talk to because they had kids in the background with virtual learning and everything else. And so they actually, the home visits were even extended virtually, which was an interesting learning from it. But then, how do we continue to make those touch points? But making sure that the staff are okay. That was my biggest emphasis in the very beginning when we moved to remote. We had several staff that were really, truly impacted by COVID who lost family members. I have a staff person who lost a mother and a father, and to COVID. So these were really deep issues. I mean, we were very, very impacted as an organization by COVID. And so, you hear about this grief gap that I heard about, that, Black and brown folks were disproportionately impacted by the grief of COVID, that there was true loss there. And so you have to work within that context. It's like, we've got to be okay. So I implemented some self-help sessions for the staff after getting through crisis mode, but we did implement around, it was like a 2-month series of we called ourselves wellness warriors. So brought someone in to do that, to focus on self-care, but to celebrate each other, because we had lost that face-to-face connection that we were so used to having. So that was one of the things. But then also making sure, I hate to reuse the word adaptability, what do we then look like? How do we expand upon the mission? And again, we know that as a direct service organization, we had to go from, obviously, from seeing in-person care, we went to telemedicine. We went to the virtual home visits. We did virtual health education. So it has been a journey, and it continues to be a journey. But I think true steady leadership and making sure that your staff know that you're there for them and you care about them, that goes a long way. So you can't just focus on who you're serving. You got to take care of your staff and make sure they're good.
I love that. It's so important that we have to also take care of ourselves. Well, I have one final question for you. How can community-based organizations and professionals evolve to fundamentally transform the way we think and act about health, well-being, and equity?
That's a great question, Shannon. I think, over the course of this year, one of the things that has happened with COVID is there has been more attention and acknowledgement of the issues of health inequities and racial inequities. And I think that we need to really continue to lean into that, and we need to, um, we need to shine the light in this moment and not let that attention wane. I have seen the funding community, I've seen, the corporate community, um, really kind of show more interest in that. And I think that especially when we think about some of these issues like maternal health and maternal mortality, we need to keep that front and center. It cannot just be the flavor of the month. It needs to be, this has been a problem. It's continuing to be a problem. When it comes to Black women, it's been, that we're 3 to 4 times more likely to die, because of a pregnancy complication. So we need to really hold on and press in. But I also think that it's so important that community-based organizations, we so often are laser focused on our community, what we're doing. We don't get an opportunity to look up and see the wins, to see the stakeholders who are there and are willing and ready to roll up their sleeves and work with us. And that's one of the things also that I did appreciate about this experience with IHI, because there were some partners that came to us because of they knew the work of IHI and they were excited to be a part of the effort, and they had not worked with us before. And so that's where I talk about the coalition building is so important. I think community-based nonprofits really can benefit from being part of larger initiatives such as this, because there's this opportunity to connect with partners and folks that we haven't worked with before. And all it does is it allows us to leverage resources, to leverage, thoughts, and ideas, and get more work done. So I do think that it's important that we stop just. It's easy to be laser focused and not look up and see the bigger picture and how we could all be working smarter, not harder.
Oh, I love that. Taking time, such great advice to look up and celebrate the wins along the way, for sure.
Celebrate the wins. So true.
Jamie, thank you for sharing your insights and lessons learned from our work in partnership. I'm grateful for the critical work you do every day to improve the health and well-being of communities through the work of organizations like yours in Atlanta.
Well, thank you so much for having me, Shannon. It has been a pleasure working with you, the team, and doing this work that, it could be, it's the topic itself, it could be heavy, but, working together and getting some really valuable tools to do the work, it's been very worthwhile and beneficial. And so we really appreciate it. I appreciate you, Shannon.